Good afternoon, everyone. My name is Tom Ward-Davis, and I would like to welcome you to the Activ Doctors Online February webinar. In the spirit of February's National Heart Month, the topic of discussion today will be congestive heart failure. In today's webinar, we will learn what congestive heart failure is, what the causes of congestive heart failure are, and finally, how we can treat congestive heart failure, or CHF. Our expert speaker today is Dr. Howard Zahalsky. Dr. Zahalsky has been with Activ Doctors Online since 2010. He received his bachelor's degree and medical degree from Brown University. He did his residence at Johns Hopkins University. He's the former chairman of the Department of Primary Care at Virginia Hospital Center and holds multiple university teaching assignments, including clinical assistant professor at Georgetown University. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you, Tom, for that kind introduction, and thank you for having me today. So today's topic is CHF, otherwise known as congestive heart failure. Before we start, I just want to give a little background on congestive heart failure and tell you an amusing story. So back when I was still in medical school, before I had learned very much, I was given the assignment to do a research study on congestive heart failure. So I went to research, what is congestive heart failure? And I started to read about it in some of my textbooks, and they all started talking about fluid on the lungs. And I said to myself, no, I don't want lung failure and congestion in the lungs. I want fluid on the heart, congestive heart failure. And it took me several hours of research until I learned they were one and the same. And on the next slide, we'll see why they are actually one and the same. So in order to understand congestive heart failure, we really have to understand the path that the blood takes as it travels around the body. The blood starts in the heart and gets pumped by the most powerful part of the heart, which is the left ventricle, to the rest of the body. Now, in the middle of this picture, you can see the heart, which is kind of a pink structure, and you can see that it has two parts, one on the left and one on the right, where there are arrows going through the heart. Now, because of the way doctors think, we always look at a picture like this as if it is someone looking directly at us. So the left part of the body is actually on the right part of the picture, and the right part of the body is actually on the left part of the picture. So you can see towards the middle, there is a part of the heart called the left ventricle that is actually on the right side of the picture, and something called the right ventricle, which is on the left part of the picture. The left ventricle is where most of the energy of the heart is. It's where the heart pumps the blood out to the rest of the body. Once it goes to the body, your body takes the oxygen that is in the blood, because every part of your body needs oxygen. And it goes to the body, to your head, to your arms, to your legs, to your stomach, and then it comes back to the heart in the veins and goes into the right ventricle. It passes through the right ventricle, which is actually very weak, to the lungs. In the lungs, it picks up more oxygen to go back around the rest of the body. The reason that this is important is because you can see from this picture, if the left ventricle is not working properly, then what happens is blood starts to pool in the left ventricle and back up like a traffic jam into the lungs. This causes fluid in the lungs and that congestive heart failure that I was researching way back in medical school. So in congestive heart failure, the left side of the heart does not work properly. The left side of the heart, as I said on the previous slide, is the part of the heart that does the most work. Pumping the blood all around your body is a lot harder than just pumping it straight to the lungs. So if the left side of your heart doesn't work, the blood can't get pumped to the rest of the body. But what happens to the blood? It's still coming back to the heart. It's still flowing in the blue section of those slides back to the heart at about the same rate. Well, you end up getting a traffic jam. You get fluid in the lungs because the blood that is coming through the lungs to the left side of the heart gets backed up, and it backs up into the lungs, and it basically sits there like puddles in the lungs. The far right picture on this slide is showing this little bulbous lobular picture. Those are what's called alveoli. Alveoli are the littlest parts of your lungs. Think of your lungs like a tree. Your trachea or windpipe is the big trunk of the tree. Then you have what's called bronchi, which are the main branches of the tree. And then you get littler and littler and littler branches until eventually you get to leaves. Your lungs are built the same way, except think of the tree as being upside down with the trunk at the top. You get littler and littler and littler air passages until you get to these lobular alveoli. And the alveoli are where the blood mixes with the oxygen and is able to give oxygen into the blood. Well, if the fluid backs up into the lungs, then these alveoli, which are supposed to be filled with oxygen-rich air, get filled with fluid, and it's kind of like trying to breathe underwater. It's almost as if you're drowning from the inside, and oxygen can't get into the alveoli, therefore it can't get into the blood. Therefore, even if the heart was pumping properly, it can't get to the rest of your body, and your body feels oxygen deprived. It feels like you're drowning. So why would this happen? Why would the left side of your heart not work? And therefore you get fluid backing up into the lungs, and therefore you don't get enough oxygen circulating around your body. The result of that is heart failure. That's the term for anything that is causing the left side of your heart that's supposed to be pumping the blood to the rest of your body to not work. You can see in this picture that on the left side of the picture, the red chamber in the heart, which is your left ventricle, has a nice, thick, muscular wall. But on the right picture, the one that's labeled heart failure, the muscle layer on the left ventricle is now stretched out and it's thin. And this is because something has happened to weaken the heart muscle. There are lots of things that we're going to talk to shortly about why the heart muscle gets weakened. But I want you to think about this as if you had a rubber band. On the left side, you have a normal rubber band, a rubber band that you just took out of the package. It's nice and it's stretchy, and if you use it to hold, let's say, your daughter's ponytail in place, it's going to hold it really well. But now imagine that you've used that ponytail elastic or rubber band for 5 years. Your daughter's now a teenager. She's been using the same rubber band. It's going to be all stretched out. The rubber band isn't going to be as stretchy anymore. It's going to look bigger before you put it into her hair because it's going to be stretched out, and it's not going to have as much tightness holding the hair in place, and her ponytail is probably going to fall out in gym class. What can cause this to happen? The main thing that causes congestive heart failure is heart disease and heart attacks. In this picture, you are looking at your heart, or somebody's heart, sliced like a loaf of bread. Now, why would we do that? Well, doctors do that just to look and see all the different parts of the heart and what the problem is. So in this, you can see in the center of your screen, there appears to be a circle of red. That red is muscle, with a couple of bumps pushing into the center of the circle. That is your strong left ventricle. The left ventricle, which is the left side of the heart, is, as I said, the stronger side because it has to pump the blood all throughout the heart. Then protruding off of the left side of that circle is kind of a C-shaped thinner area of muscle. That's the right ventricle. That's the part of the heart that's responsible for just pumping the blood into the lungs. That part of the heart doesn't do nearly as much work, so the muscle isn't nearly as thick, and it doesn't have as many blood vessels flowing to it to give oxygen to the heart itself. When you have a heart attack, this can cause part of the heart to squeeze less. So on this picture, you can see that darker red area towards the bottom of the big left ventricle circle of muscle. That's an area that has been damaged by a heart attack. That part of the heart will no longer squeeze properly, and this can get in the way of the heart squeezing and pumping the blood and create that kind of backup or traffic jam that I was talking about. Another way to think of it is, imagine you're squeezing one of those little stress balls that you might have at your desk. If you are really stressed, you can give it a good squeeze over and over. But now try to squeeze it without using your middle finger or your ring finger. Sure, you're able to squeeze it, but it's not as good a squeeze, it's not as hard a squeeze, it's not as organized a squeeze. That's what happens to somebody like this who has had a heart attack and part of the heart muscle doesn't work as well. The heart's still able to squeeze, just not as efficiently. So what other things can cause heart failure besides for having heart attacks? We'll see on the next slide. Alcohol. Alcohol is a big cause of congestive heart failure. A small amount, 1 glass of wine a day, is actually supposed to be good for your heart. But alcohol in excess, and excess can be very different for a lot of different people, can be directly toxic to heart muscle. It can cause heart muscle to get floppy. It can cause heart muscle to get weak. It can cause the heart muscle to thin out, like you saw on the earlier slides. And because of all of this, it can even cause the heart to squeeze out of turn, to cause an arrhythmia. So first of all, let's talk about the effect. If your heart doesn't squeeze as well, it will cause not one section of your heart, like on the previous slide, to squeeze less. It will cause the entire heart to be weaker and squeeze less. Now think of that stress ball again in your hand, but imagine your hand has arthritis. You're just not able to get that good squeeze. You might be able to squeeze it a little bit using all of your fingers, but you're not able to get a really good squeeze on that stress ball and pump the imaginary blood inside of the stress ball around the body like you should be able to. Then again, you could have the arrhythmias that we were talking about. Going back to my stress ball analogy, now imagine that you're trying to squeeze that stress ball, except you can only use 1 or 2 fingers at a time. The heart is supposed to squeeze from top to bottom and from left to right. This gives a nice, we call it peristaltic activity. It pushes all of the blood in the right direction. But if parts of your heart squeeze out of turn because of an arrhythmia, some of the blood is getting pumped forward, some of the blood is getting pumped sideways, some of the blood might even be pumped backwards. And this leads to a much less efficient pumping of blood and can lead to blood going the wrong direction and, again, congestive heart failure because your blood is not being pumped forward properly. And this can all be because of alcohol. So when should you be worried that you might have congestive heart failure? Well, usually you already know that there are some things wrong with you. You may already know that you have had a heart attack. You may be an alcoholic. You may have already been told you have other medical problems which can predispose you to congestive heart failure. But once you do have congestive heart failure, here are some of the symptoms you can get. The most common ones are shortness of breath. With all of that fluid in your lungs, it is as if, again, you are trying to breathe underwater. It can be difficult to go upstairs. Sometimes if it gets bad enough, it can be difficult, breathing-wise, to even walk across the room. Because this fluid is in your lungs and irritating your lungs, imagine you drank a cup of water the wrong way. What's the first thing that happens? You start to cough. And you can get a wet, mucousy cough when you get early congestive heart failure. In particular, because the water tends to layer out in your lungs when you're lying down, the cough and the shortness of breath are typically worse when you are lying down in bed and asleep. We call that either paroxysmal nocturnal dyspnea or orthopnea. Don't worry, there won't be a test on those words, but basically both of them mean you can't sleep comfortably lying flat on your back. A final thing that you can get is edema or fluid in your ankles. Sometimes you can get so much of a backup of fluid into your lungs that the fluid backs all the way back into the other side, the right side of your heart, and then all the way back into the rest of your body. Well, where's that fluid going to end up? Gravity has a say here, and the fluid will back up all the way back into your legs, which are the farthest part from your heart and the lowest part of your body by gravity. And you can develop swelling of your ankles. This can be another early sign of congestive heart failure. How do we treat it? So the first thing that you usually do with congestive heart failure is a medicine called beta blockers. Beta blockers are the main medicine that has been shown to extend the life of people with congestive heart failure. They work by slowing down the heart. Now you say, Dr. Zahalsky, you must be crazy. You already told me that congestive heart failure is caused by the heart not squeezing well enough. Why, if the heart is already squeezing not well enough, would you want to slow the heart down? That's certainly going to cause even more of a traffic jam. And I say, no, it doesn't actually work that way. I want you to picture, like on this slide, someone trying to hammer a stubborn nail. If you hit that nail very, 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 very quickly, over and over and over again, but lightly, that nail is going to be difficult to pound in, and your arm's going to get tired really quick. On the other hand, if you take your time and you take one big swing and you smash the nail, that nail might go in with a single strike. In other words, going slow and steady, kind of like the tortoise in the race with the hare, is a much more efficient way to pump blood. And if you slow down the heart just a little bit, it can allow the heart to fill better, to squeeze more efficiently, and to pump the blood better, while at the same time putting less strain on the already weakened heart muscle. So beta blockers are considered an excellent medication for patients in congestive heart failure. So here's the next medicines that are usually used with congestive heart failure. They're called ACE inhibitors. ACE is a chemical in your body that is used to determine how tight your blood vessels are. ACE inhibitors loosen the blood vessels by blocking that chemical in your body. Why would you want to loosen your blood vessels? Well, the excellent example I found was trying to blow up a balloon. Imagine your heart is your mouth, and you're trying to pump, instead of blood, air into a balloon. What's the first thing you do when you get that balloon out of the package? You stretch it out. You pull it this way, you pull it that way. You make the balloon looser, and that will make it easier for your mouth pump to blow up the balloon. The heart works the same way. If you loosen up those blood vessels a little bit, it makes it much easier for the heart to pump blood into the blood vessels and pump it around the body. So this causes the heart to do less work, get less stretched out going forward, and pump using its what might be limited resources because of thinned heart muscle. On the next slide, we'll see the next medicine that we use, which is diuretics. These medicines are quite possibly some of the oldest medicines that we have to treat congestive heart failure. They're medicines that literally directly pull fluid out of your body. They're going to pull fluid out of your blood, and they're going to pull fluid out of your lungs. Your blood is made up of 60 to 70% water. So by pulling the extra fluid out, you still have the same number of blood cells. Your blood is still able to carry just as much oxygen, but there's less fluid. There's less other stuff that needs to be pumped around with your body. Your heart can be spending more of its time pumping blood cells and oxygen and less of its time pumping water. Now, a side effect of these medicines is that they do this by making you pee more often, hence what I hope is an amusing slide of men running to the bathroom to get rid of some of that extra fluid. In addition, they will pull some of this extra fluid out of your ankles as well. So if you have congestive heart failure with edema, fluid in your ankles, the diuretics can help that a lot as well. So how can Activ Doctors Online help you if you or a loved one has been diagnosed with congestive heart failure? Well, there's a lot of ways. First, we have our revolutionary personal health records. These are online records that go with you wherever you go, to any doctor, to any place, even overseas. You can use your records for a lot of things. Unfortunately, patients with congestive heart failure tend to be on a lot of medications, and a lot of my patients have trouble remembering all of their medicines as they go from doctor to doctor. Our records can keep excellent track of your medications to make sure all of your doctors know exactly what you're taking. You're also able to carefully follow some of your symptoms and your weight. One of the most important things for patients with congestive heart failure to do is to carefully track their weight, because as fluid builds up in your body from the congestive heart failure, your weight can go up, and that can be a sign that you need more medication. So by using your personal health record, you can track your weight for your doctors, and your doctors can have access to this information, and that can help to treat you. In addition, with our online second medical opinion, you can have access to our network of thousands of physicians who are some of the top doctors in their fields. So if you're just interested in another cardiologist opinion as to what the best treatment for your congestive heart failure might be, we will be able to provide access to you to our network of doctors and get you a second opinion, often in less than 48 hours. And finally, with our e-consultation access point, you're able to, if your doctor signs up, talk with your doctor online and be able to get more information right when you want it in a much more convenient way. So with that, I'm going to pass it back over to Tom to talk about Activ Doctors Online a little bit more and tell you how you can start signing up for our online PHR with second opinion and e-consultation.
Well, thank you very much, Dr. Zahalsky, for your very informative presentation. Our ADO vision is to educate, engage, and empower members to take control of their health destiny to save time, money, and even lives. We hope you've enjoyed today's presentation, and we invite you to start your free 30-day trial over at activdoctorsonline.com and by clicking Get Started. For more information or to schedule a demo, you are invited to contact either Dr. Zahalsky or myself using the email addresses on screen now. You can also find us on all the major social networking platforms by searching Activ Doctors Online. And you can also follow our blog on ownmyphr.com. We thank you for watching today, and we look forward to seeing you next time.